Well, this is the fifth session in prostate cancer station in pathology in MRCS. Okay, and now the examiner is going to ask you many easy questions. And when I say they are easy, they are really easy. They are not tricking you. These are easy questions, okay? So they are going to ask you the first question here of this group, about 6 or 7 questions. And they have a good mark and they can help you to pass the station and succeed in it. So they'll ask you about, okay, this gentleman, either if you are suspecting prostate cancer, or after radical prostatectomy, you are suspecting, for example, metastasis because PSA is high. So what are the investigations that you are going to do? First of all, you already did PSA. If it is not done, you want to do it for prostate cancer. And number 2, you are going to do alkaline phosphatase. Okay, and third, you are going to check the serum calcium. So this is related to the prostate directly. Alkaline phosphatase and serum calcium are related to metastasis to the bones and vertebrae. Okay, so they will be high if there is any metastasis. Fine, this is the answer for this question. Let's see the next question. He is going to tell you that this patient developed fever and he has read the sputum. Okay, what do you think? And this is post-operatively. Okay, so what is your diagnosis here? Diagnosis here is UTI, urinary tract infection. That's it. This question is done. Okay, well, he's going to ask you another question. Okay, and he will ask you what is the most common organism, okay, for UTI, and you are going to tell it is E. coli, as you know. Okay, this question is also done. Okay, we'll go to the next question. And the next question here is going to ask you what is the most common cell type of blood or blood component that will be dominating in UTI. Okay, and your answer here will be WBCs, right? The white blood cells will be dominating because there is an infection. Okay, he's going to ask you another question which is a little bit tricky, but it is easy. What is the main component in WBCs? What is the main component in WBCs or white blood cells? And the main component, as you know, is neutrophils. This seems like a stupid question, but it is a tricky question, and some people fail to answer it if they do not know the answer. Okay, well, he is going now to ask you another question, and this needs some thinking. Okay, this question, I think it's the 5th question, I don't know. Yes, it's the 5th question, and here is going to ask you why do WBCs or white blood cells increase after surgery, okay, or post-operatively. After any operation, if you check the WBCs of the patient, you will find that his WBCs are high. Okay, so why that happens? Okay, and this is actually this is called this is due to something called surgical stress induced acute phase response. Okay, so most of you know about the acute phase response, but here in this case this is surgical stress. This is an acute phase response induced by surgical stress. Okay, and you know that surgery is a stress to the patient, so a surgical stress induced acute phase response will lead to a rise in WBCs. Okay, so what is the hormone responsible about stress in this case, and in most of the cases actually it is cortisol, right? Cortisol hormone the hormone responsible in any stressful condition. surgical or non-surgical, but especially in the trauma case, cortisol is responsible here. Okay, so cortisol will lead, okay, to the demargination, something called demargination of the neutrophils. Okay, and I will explain that to you now. Okay, and actually the neutrophils are usually closer. You know that there is when you studied inflammation before, neutrophils pass through the stream, and then there is something called margination, right? So, and the margination, and then after that they adhere to the endothelial wall, and then there is something called migration, and so on till they reach to the infection in the interstitial area or space. Okay, so because the human being is always vulnerable to infections, there are many neutrophils that are at the margins. Okay, so many neutrophils are here, invisible in these areas. Okay, and actually the stress response leads these neutrophils to get in the stream here. Okay, not attached to the endothelium. And when you check the WBCs, you will find that there are high WBCs with neutrophilia. Okay. Anyway, all what you need to know here is that the cause of WBC, high WBC, is postoperatively is the surgical stress-induced acute phase response. This is the answer that you want to tell. If you want to explain more, it will be fine. Okay. So I will see you in the next session.